So we're going to start out this morning hearing about an update actually on the cognitive and behavioral assessments that have been started actually about 6 years ago and most recently 2 years ago, and that are ongoing for this conference. And so we're going to have, I think, two speakers tag teaming it, Dr. Mattson and Dr. Akshimoff from here in San Diego. Dr. Mattson is on the faculty at San Diego State. Dr. Akshimoff is on the faculty here at UCSD. So Sarah, if you want to come up. And I know we have a t-shirt and I think a gift certificate, and I know you weren't here yesterday, but the Sulpizio family has generously donated wine from their personal private vineyard up north for all the speakers. So it's a great pleasure to have you. Thank you.
Thank you. Good morning.
Good morning.
Welcome to San Diego. The sun will come out. It's been beautiful the last few days. It's always like this in June. I hope you have an opportunity to enjoy your time here because it's really a wonderful city and there's so much to do. But I also want to start out by saying I very much appreciate being here and being a part of this conference and meeting all of you and your children. It's really been, this is my fourth conference. And our fourth set of assessments, and it's just really been an amazing experience. I'm a neuropsychologist. I work at San Diego State, and my area of expertise is developmental conditions that have an onset in the prenatal period, so of which Jacobsen's is one. And I'm just thrilled to be a part of this. So what I thought I would do, if I can. Yeah, microphone, that way?
To be a little bit closer. Yeah, you're pretty tall, so I think I can turn that.
I can take my shoes off. Is that better?
No idea what I'm doing here.
Just press buttons.
I'm just kidding. My son does.
Okay, so what I thought I would do would just to go through what the assessment opportunities we have and a little bit about what we've learned so far, and I'd also be happy to answer questions. Dr. Akshimoff is going to talk after me about some of our specific assessments, so we'll try to keep within our time. Okay, so we try to do, every child is different, and we try to do as much as we can with each individual child. So some kids will get a lot more than others, and we're testing people of all ages. So we have babies and we have all the way through adults, and we do different things for different age groups and ability levels. So we always try to administer a general ability measure. We do assessments of social and communication behavior. We do behavior ratings. And then I'm going to talk about just some of our results that we've got, sort of our ongoing results. I should just give you a general caveat that I'm going to give you as much information as I can because I feel that it's important to share. You've shared so much with us by allowing your children to participate that I think it's important for me to share what we found. But it is an ongoing process, okay? So I look back at what I presented last year and I tried to update it, and it's different. And in 2 years, it will be different again. Okay, so we're continuing to add information to our database, and it will change as we go along. So I just wanted to, give that little caveat. We have, at this point, we've had 51 people participate over the last few years, and I think that's a great number of kids, and we're always adding. We have actually 30 test sessions scheduled between yesterday and Monday, which my research assistants are sort of pulling their hair out, but it's a lot to do, but we want to take advantage of you all being here. We have 17 kids being assessed over the next few days, 2 babies and 3 adults, so we're really excited about that. Okay, so the first thing we try to do is an assessment of general ability. So we do different things for different ages. For the babies, we do something called the Bailey Scales of Infant Development, which takes about 45 minutes. And these are all general numbers because it will vary based on each individual child. We're doing the Differential Ability Scale for our children, kids up through 17 years of age, and that also takes about 45 minutes. And then for adults, we're doing the Wechsler Adult Intelligence Scale. And all of these measures will give us a general idea of general ability level. And we'll combine the results from those measures so that we'll try to get a general ability level assessment for each person who's participated. We do assessment of social and communication behavior using the Autism Diagnostic Observation Schedule. I'm not going to talk very much about this because Dr. Akshimov is here and she's going to talk to you about it in detail. These are my kids. Let's see. I can't find the pointer, but that's Maggie on the lower left and Henry in the white shirt with the big smile in the lower right. Okay, so we also do lots and lots of questionnaires. So if you've already agreed to participate, you've seen this packet of questionnaires. And I do want to put a plug out that if you weren't able to come to our lab for assessment this year or any other year, or perhaps your child didn't come with you, we can do lots of things by questionnaire and over the telephone. Okay, or maybe you think you just don't want to do the in-person assessment. That's perfectly fine. But if you're interested in doing questionnaires and interviews over the telephone, we'd be happy to do that. And I put a sign-out sheet on the table right outside where Lindsay was sitting this morning. So if you give us your contact information, we can send you questionnaires and do some interviews over the telephone, and that'll increase the number of people we have participating, which would be great. So these are some of the behavior ratings. We do the social communication questionnaire, a questionnaire called the Child Behavior Checklist, which asks about different behaviors. All of these questionnaires ask about different behaviors that your child may have. We use something called the Disruptive Behavior Disorder Rating Scale, and then the Violent Adaptive Behavior Scale. And I'm going to show you some results from these measures as we go along. But these are, if you participated by filling out questionnaires, these are the names of all the questionnaires that you did. We do some interviews to look at adaptive behavior, which is things, and it depends on, again, it depends on age. So adaptive behavior is sort of real life functioning, things that, so for example, you might ask, depending on the age, can your child make their own bed? Can they tie their shoes? Things like that. And again, it's age and ability graded. We're also doing, and this is new this year, we're doing an interview called the DISC, or the Diagnostic Interview Schedule, and it'll become apparent why we're doing this later, but we're really interested in the rates of attention deficit hyperactivity disorder in your kids, because from all of the measures that we've looked at and from what you've told us, that seems to be something that is of concern to several parents, many parents. So we're doing a specific assessment based on that, and I'll tell you more about that later. Okay, these, I'm not going to go through all of these in detail. We talked about the baby assessment. We have 3 adults coming this year, and we've had, I think, 4 or 5 adults over the past few years, and we're really excited to have the adults participate with us. And we do a more comprehensive assessment with most of them, but again, it depends on ability level. So we do the intelligence measure, and then we look at things like learning and memory and language and executive function and academic achievement, all of the things that we are less able to do in the younger kids. So for the adults, it does take a little bit more time, but we also get more information. Okay, so for those of you who haven't been out to our lab, this is what we're all about. You would come out to San Diego State, which is about 20 minutes from here. You participate in your child. You hopefully will do the questionnaires either before you've got here or soon after. So your job as a parent is really to be there with your child to help them, not help them answer any questions, but to just be there as a support so that they know that they can feel comfortable with us. And some kids can go separate more easily, and some kids, need their parents nearby. And so we tried to limit it this year so that the parents weren't doing anything in the lab, that they could be with their kids the whole time if they needed to be, okay, which is a change from the last time. And then, so the kids do, if they can, they answer questions, they do some puzzles. It really depends on, every kid is different, and we do different things with them as a result of that. Okay, So what I'd like to do is tell you now just a little bit about what we found over the last few years. So these are things that have been previously reported in the published literature, that in Jacobsen syndrome, there's delayed development, including both motor and speech development, that there's mild to severe intellectual abilities, learning disabilities, and behavior problems. Okay, so what I'd like to do is to talk to you a little bit about what we found from the 51 people that have participated with us, and this is up through the last conference, which was 2010, okay? All right, so we ask about medical issues that are of concern, and these are the rates of those. You'll see the highest rates in blood problems, heart problems, of course, vision problems, and then lower rates in things like seizures or hearing problems. Having had heart surgery is low, even though they have a high rate of heart problems. Of the kids, and again, these are of the kids who've participated. We ask about developmental milestones as well as you can remember them. We were just joking that my son, who's 5 now, has been asking me what his first word was, and I just don't remember. And I feel really badly about that, but so we know that this is all couched in what you can remember. So we ask about when did they first crawl, when did they eat solid foods, when did they sit without support, say their first word, walk, or stay dry during the day. And these you can see the results of that. So I put on there what the typically what a typical child would, what age they would perform these abilities. And so you can see we have delays. And in some cases they're bigger than others. So walking has a bigger delay. Staying dry during the day has a bigger delay. But some of the others, like eating solid foods, even crawling, are not all that out of the ordinary. Okay. So these are behaviors that we asked about in terms of school and other behaviors. So this just number of children who attend school, who are in special education, and so on. So you see we have pretty high rates of kids who are receiving special education and other special services, which of course is appropriate. And I'll just highlight that 33% of parents who took this survey reported that their child had ever received a diagnosis of ADHD, which is pretty high. It occurs in about, estimates vary, but some people say 5 to 8% of school populations, some people say much lower than that. So 33% is elevated over the general population. And that's one of the reasons why we've added some specific assessments about that. So this is the, from the child behavior checklist. This is one of the questionnaires that I mentioned. And so what we're showing is that these are, okay, so 50, just to orient you, the score of 50 is typical. That would be if you gave this questionnaire to 1,000 people in the general population, the average would be about 50. Okay, and a higher score means more behavioral issues, and a lower score means less behavioral issues. So you can see we have, we don't have elevations in every area. On the bottom, it's anxious, depressed, withdrawn, somatic problems, social problems, thought problems, attention problems, rule breaking, and aggression. So you can see that the highest rates of these, and again, these are what parents are telling us. The highest scores are in social problems, thought problems, and attention. And so those are areas, so we're following those up with our other assessments as well. And again, the attention problems is one that really spurred us to do a more detailed assessment in that area. I thought I would give you just a comparison. So many years ago, I tested kids with Down syndrome who also have a genetically based condition and also have behavior concerns as part of the profile. And these are the results of the same questionnaire administered, not at the same time, so many years ago, but just as a comparison. And you can see there are elevations in the same, it's sort of a similar pattern, but the elevations aren't quite as high, especially in the attention domain. Okay? All right. So the CBCL also gives us areas that might require additional attention. So these are, I don't know if you've heard of the DSM, but it's the book, called the Diagnostic and Statistical Manual. It's the book that psychiatrists use to talk about different conditions like ADHD. Okay, and it has many, many diagnoses that most of which won't apply here. But the CBCL provides us with an idea about whether we should further look at specific areas. It doesn't give us a diagnosis, but it does say, okay, you might want to look at ADHD in this particular child. And so we looked at those scales, and you can see these are, so when it's in the borderline or clinical range, that means the score is high enough that a psychiatrist or psychologist might want to follow up in that area. And you can see again that the highest scores are in the ADHD area. And we do have a number of kids who are in the borderline range for conduct, which is like rule breaking. Another thing that I think is consistent with previous literature is that there's a somewhat elevated rates of anxiety. Okay, and again, these are all parent ratings. Right. So just one of the reasons that I show this to you is just to, I guess, to convince myself that following up on ADHD really is a good idea in this population. Okay, so that's where we get to. Is ADHD elevated in Jacobsen's? And it's a question we don't know the answer to yet, but I've listed here some evidence for why it might be worth pursuing. Okay, so, and these are things that I've already told you. On the CBCL, we had elevated ADHD type behaviors. We had 34% of cases were rated in the borderline range for ADHD and 31% in the clinical range. So as a total, that's 65% of the kids whose parents completed the questionnaire said that they were concerned about ADHD type behaviors. And the ADHD problem scale had the highest score of all the other problem scores. We also, and I also mentioned this previously, that in our general questionnaire, 19 children had previously been given a diagnosis, and 10 of those kids had been treated with medications that were related to ADHD. And then finally, on one of our questionnaires called the Disruptive Behavior Rating Scale, we only have these on 19 people, but 53% met criteria for ADHD on that questionnaire as well. So you can see that we have about half of the people who've of the children whose parents completed the questionnaire, about half of them seem to have concerns about ADHD. So I think that there's a reason to follow up on that, and that's why we're doing additional assessments in this area. But there was another, I think we looked at, there was conduct was another issue that was somewhat high on that other slide. We didn't find anyone who actually met criteria for conduct disorder, which is so by comparison, it does seem to be specific to ADHD and not just a general disruptive type of behavior. It's not conduct disorder, and only a few kids met criteria for oppositional defiant disorder, which is another sort of disruptive behavior diagnosis. Okay, so what I'd like to do now is to, and I showed this last year, so or 2 years ago, so if you're here, this is an update from some of the things that we've done. So what we're trying to do is to look at the relationship between the size of the deletion in each individual child and their performance on our scores. And this is one of the things that, as I mentioned at the very beginning, these things are changing. As we add more subjects, more kids in our study, these numbers are going to change. And so what we're looking at here is the relationship between the deletion size and the general intellectual functioning. And as you may have heard it reported before, that as the deletion size gets larger, which is on the horizontal axis, so it goes from 7 to 15 or 17, as that deletion size gets larger, the general intellectual function goes down. We do have exceptions. So you'll see there's a child whose deletion is not that large who has a low score, and we also have a child whose deletion size is larger but has quite a high score. So there are exceptions, so as with anything. But this is our general relationship. Okay? All right, so the other, so we're also looking at adaptive behavior. So this is based on one of the interviews on adaptive behavior, and again, as the deletion size gets larger, the adaptive ability gets lower. But again, there's an outlier up there at the top who's got a really high adaptive score. Okay. And I should say that the relationship between this score and general IQ is very strong. Okay, so it's not surprising that we see this same type of relationship, because as general ability or IQ gets higher, so does adaptive ability. So these two things really go hand in hand with each other. But then I thought I would talk a little bit about just some of, since we're primarily focused on behavior, and so this is the relationship between the deletion size and our child behavior checklist behaviors, and we see a pretty good relationship here. But what's curious to me, and I don't quite understand, and I'd love to hear anybody's ideas about this, is that as the deletion size gets higher or bigger, the behavior ratings get better. So fewer behavior problems. Whereas in the smaller deletion sizes, we see more parents are rating more behavior problems. So I'd be happy to hear anyone's idea about that, but we see it consistently on our behavior. This is the externalizing, so these are things like rule breaking, attention problems, conduct problems. But again, you know, a reasonable relationship, but again, as the deletion size gets larger, behavior, the ratings get stronger or better. And we see that on these measures as well. This one is particularly strong. Okay. All right, so just to summarize so far, we feel that the assessments that we've done have been consistent with the previous literature, and they suggest that the profiles of behavior that we see in JS are unique to this disorder, and which would and they're different, therefore they're different from other developmental conditions. We're trying to understand the relationship between deletion size and behaviors and ability, because we think that that will be really important for families that have a child with JS. Okay, so when they get have a child who receives a diagnosis, they will be able to provide information that will help them predict what ability levels their child would have, and therefore what services they should try to get for their child as early as possible. Okay. So what are we doing? We're always trying to collect more information. So we have a lot of people coming in this year, and we're really excited about that. We've added our focus on ADHD as well as our focus on autism, which we added 2 cycles ago. And we're continuing to try to seek external funding so that we can continue the research that we've been doing so far. And I just want to repeat what I said at the beginning, is that we really, really appreciate all of you and your participation. And obviously we couldn't do it without you. So we really appreciate it. Thank you. We have time for questions? Or?
We're going to wait till the panel.
Wait till the panels, okay.